Well, today is a special day. We've got an extension of the town hall. We're starting earlier for our member spotlights. And I'd love to thank our community in Europe and elsewhere that have been asking for earlier start times. So there you go. And also, it was fitting of Jayna's schedule. Christian Lycos was going to do it, her colleague there, and also VP of partnerships. But today we're extra lucky to have Jayna Smith from Trusaic and the VP of Global Partnerships, recent promotion as well. Congratulations there, Jayna.
Thank you.
And with that, we're going to hear a little bit more about who's Jayna, what is Trusaic, and the recent press release about their complete software providing comprehensive visibility to penalty risks with the IRS and so forth. There's a lot, 1 in 4 organizations, I couldn't believe it, are audited for non-compliance. So there's a good chance if you're in the space or you have clients in the space, their days are numbered if they haven't been audited yet. So Trusaic could be the hero that saves the day. We'll find out, and feel free to tee up your questions in the chat or shout it out.
I want to thank everyone on the call and thank Ward especially for inviting me. A bit about me, Vice President over at Trusaic. I'll talk a little bit about Trusaic, but I've been through the gambit of small organizations to large organizations, all in HR and payroll and benefit. From payroll, starting with Bill at Genesis, that was my first job. IBM for about 5 years in the compensation space, and then now at Trusaic. And I'll talk a little bit of who Trusaic is. I'll go through the Affordable Care Act, what that is, what that means to your either customers or yourself, and any stories I just want to make it really open, ask questions. I'll do my best to answer. The ACA, the Affordable Care Act, is very complicated. There's like 20,000 pages that go into. So we've scaled it and tried to figure out how to help organizations with ACA. So a little bit about us. Hey, you guys were talking about, kind of your adventures through, exercising and traveling. And that is on the right there, I think you can see it, is our CEO. He trekked to the South Pole twice.
Wow.
So you've got some extreme people here. Nothing. I'm lucky if I get to walk around a track for a while.
Nice.
But that is the South Pole, that little pole. So kind of with him, this is kind of, he takes, 3 to 6 months, and he goes to Minnesota, and he has traveled with his sled pulling 200 pounds of equipment, everything else around. And there's like probably 6 of them in his last go around. He was trying to do the North Pole this time, but with the war and trying to get over to the North Pole area, didn't do that. But that is Robert. He is a regulatory attorney, and he started Trusaic in 1999, based out of Los Angeles. And it started with compliance or ACA, workplace equity, which is the pay equity piece. We were consultants, and then to actually help organizations with ACA, we built internally the software packages for ACA and workplace equity. And then we decided to, hey, aside from consulting being one and done, let's turn it over to organizations to actually some software as a service. I'll talk a little bit more about ACA. But knowing workplace equity, that's what we do. We do pay equity for hundreds and hundreds of organizations, making sure they're in compliance. So everything is around compliance.
So if I can ask just quickly, for those that don't know about workplace equity, is that strictly just like salary? So if people in 2 positions are getting paid the same if they're doing the same job, or is there more to it?
Yeah, there's a lot to it, and it's global pay equity. So the EU and the UK have all kinds of, so think of it as in the US, we have all the states, and each one has kind of different pay equity. Some of them have transparency, like New York. Colorado started it. So transparency in offers,
Mhm.
and it's
Job
all to
ads
do
as
with
well?
pay. Yeah, because there's been a lot of surveys that women don't actually, negotiate that great for themselves. They negotiate well for others for pay, but it's
Mhm.
how we were raised to be a little bit more demure. So the pay transparency instead of haggling, it's almost like thinking of haggling for a car, right? A new car. You let go. It says this, but you're between here and here. So it actually puts it out there. I mean, do you remember? I remember like my mother, you couldn't even ask how much someone gets paid, even in your family. It was like a weird taboo. So now all the kids, my two daughters, they're right out there. They're like, I make this, and they tell their friends, and they tell their friends about 401k and how much. So each state and even counties can have different pay equity goals. So that's what we do. And then if you look at countries, each country, and then the EU, so there's all kinds of fusion out there. So that's what we do. We pull it all together. We have software. We look at all the laws. Same thing with ACA. We look at all what's changed, how we can help organizations because it's a pain in the neck. ACA is a pain in the neck. It doesn't add anything to an HR person. It's just here's more forms every month. I have to do this, or I have to make sure that new people that come in, they want insurance, or if they don't, you have to have them sign off, and then the insurance has to be of minimum value for them, and they have to be able to afford it.
So
But I'll get
just
into that
it's not just salary, it's also then benefits, other things that I guess have a value to them,
value to them. So
like
pay
the
equity.
company jet that you get too, right?
Yeah. So jumping into the pay equity and what is the Affordable Care Act, if you look at it, it was started in 2010. It helps people to afford insurance at the end of the day. And then the government has a healthcare marketplace that people who cannot afford insurance can go to and sign up for. You've probably saw all the things on TV when November starts, it's November to January, I think 31st, that people can sign up for the healthcare. So that's the open enrollment time.
Mm-hmm.
So, and there's been a lot of but about it every, repeal and replace and what's, affordable, what's minimal. So there's a lot to it. And then you've got the government involved, depending on who's in the office to say, should we get rid of it? But right now, that's not even on the agenda for the presidential race. It used to be. I mean, too many people are on it that, it's almost like, hey, should you for Social Security, should we talk about Social Security? No, no, nobody. It's like one of those, starting to be kind of one of those taboos that now we have affordable health care for probably about 20 million people that
Wow.
are on the exchange, they call it. So what it did is it guaranteed coverage for pre-existing conditions. Whoa, can you imagine that?
Right. Yeah. Advancements.
And then coverage up to your kid, dependents up to age 26, lactation breaks, no lifetime coverage limits, free preventive care screenings, and waiting period cannot exceed 90 days. So that's all good for for the individual. There was a mandate that you had to have insurance coverage or you were fined. That got
Mm.
repealed in 2018. So this is all kind of US based, but if you have US employees, and if you have over 50, now let's talk about the side for the employer, what happens with them. So here are the employer responsibilities. This is where it gets kind of very convoluted.
And your software helps manage all this.
Oh yeah, yeah, yeah. So there's a few things. So if you are an ALE, which is applicable large employee, so it's 50 or more full-time employees. Now, what is a full-time employee? Well, the government talks about what a full-time employee is. It's 30 hours a week or 130 hours per calendar month uh, is a full-time employee. And then there's even another calculation. So we do all this calculation for you, for your clients. And so that if you have a whole bunch of part-time employees and they're under 30 hours, there's a calculation for that that says, hey, even though you have, 49 full-time, you actually have, with your part-time and congruent, you have over 50 full-time employees. So
Oh,
we do
wow.
that. Yeah, everything is complicated, which makes it good for people to come to Trusaic.
Right.
Each one complication, right? So that if you are an HR person or payroll, you're trying to figure this out, that's a pain in the neck.
Hmm.
So, and the next thing is, so that coverage has to be, you have to have minimal value coverage. So first of all, if you have the 50 employees, you have to offer it to the employees and their dependent, and you have to keep track of that. And you have to send that into the IRS, the government. So you have to make sure you keep track of that. Then you have to make sure that it is of value. So there's a whole calculation for that. And when we're looking at this, it says employees do not generally know their household income, employers. So it's a household income, but there are other ways that employees can do that through their W-2. So kind of, there's another calculation to make sure that it's of value. Then there's another calculation to make sure that the coverage has value to it. That you make sure that it has that, preventative care. So then there's an insurance piece to that. So that's what makes it very complicated for employers, as you can imagine. And
Wow.
think of a large organization, or even if you bring in another company, you had 20 employees and you added another, 20 with 10 part-time, you could be over the 50.
You'd think, I mean, let's say there's 20 million companies that in North America alone that are at like in 40 employees or 45 or whatever. They're getting close to that requirement number of 50. And they have part-time employees that don't even know that they're already over that amount. I mean, how
Correct.
does the IRS say, oh, by the way, you're over, you better fix it? Or do they just, I guess that probably
Okay,
ties
well,
into the audit part, right?
yeah, that's the next piece that we could talk about is that audit piece, that what the IRS does. But I wanted to show you some of the penalties. It's crazy. Okay, so
Hmm.
here are the penalties. And this is the 1095-C that you have to fill out. And there's code. So it's not even like, there's like codes you have to know.
Hmm.
So as you can tell, and then even if you look on the IRS or their site, they have a whole bunch of frequently asked questions and going through that. I mean, if I was in HR having to do this for an organization, I'd want to pull my hair out because HR feels like this is not like pay equity that I can really look at. Hey, how are we paying people? How does it strategically help my organization? And, all that. This is more paperwork and making sure that your health care is of minimum value for your employees. So there's a lot to it. Here are the penalties, and they increase year over year.
You mean
So
the
they don't
longer you're not in compliance?
exactly. So think of it, you have to have minimum essential coverage. You have to have value that you have to make sure that 95% of your full-time employees as a percentage are offered. I don't know why it's 100%, but are offered. It has to be at least, I guess you get 95, you get that 5%
Hmm.
in your favor. But there's rules on, it's called the 4980 H, A, and B, that there are penalties. So if, let's say you have 50 employees and somebody goes on the government website, signs up, and they call it PTC tax credit, you get fined as an employer. You get fined.
Jayna, I know you covered, global in your role. Like if a company has most of their people in the US and they're concerned about this, that's perfect. If they also have employees in like Canada where there's government healthcare, does this apply there as well or
No, this is just the US employee.
right? Okay. I mean, do they have to count? So they don't have to count those employees.
No, it would be that, so they count seasonal because they'll look at the calculation.
Mhm.
Part-time, retail. So companies that really come to us a lot are retail and
Yeah.
seasonal companies. Think of like a kind of a trans workforce because there's two types, right? There's like this large organization and they can do a yearly, they have to keep track of it, but they've got their benefits down. They can kind of they have it wash, rinse, repeat pretty well. It's the seasonal or a lot of turnover because you have to make sure that every month you've got turnover. You have to make sure those employees you've been offering them minimal essential coverage. So it's really those type of employers that get, I would say, the majority of fines.
Does the ACA like get updated like at all since it came out, or is it kind of
Yeah.
static?
It does get updated as far as fines and the penalties.
Oh,
So you could say like in 2023,
yeah.
you didn't offer someone and they signed up, one employee, let's say you have, I don't know, 300 employees and one employee signed up. In 2023, you would pay annually 2,880. In 2024, it's 2,970. We don't know 2025 yet. They haven't come out yet. And then, so think of it, if you have 300 employees and one person signed up, the IRS gives you 30. So you say, okay, so I have 300 now. They give you like, hey, you don't have to pay for the 30. So now I have 270 employees that I have to use for this calculation. So that calculation, I wrote it down. So 300 minus 30 is 270 times the 2,970. You would have to pay $801,900 for that penalty.
Just because one person signed up and
Month
nobody else
for a
did it?
year. Yep. Yes.
Wow.
So you could see there's a lot at stake.
Hmm.
The unaffordable, so that if they signed up, unaffordable, if it's deemed that it's unaffordable coverage, it was 4,320. It's gone up to 4,460. However, if it was unaffordable and 10 people signed up, it's the 10 times 4,460.
Oh, interesting. It's still painful. Yeah. Wow.
Still painful.
So if you're an employer and you don't hear about this much, but you're like, oh, all your healthcare benefits are covered. I mean, are they at risk still, or is it just,
It could be. They have to make sure that it's affordable. The larger organization, they usually look at this yearly as opposed to monthly. Or the ones that don't have that high turnover, they need to do it monthly.
I mean, from a compensation perspective, whether they're employees or you're trying to recruit somebody, right? Benefits is usually a big component, right, of why they're joining your company. And if the employer's like, we're going to pay 100% of your premiums, that makes it instantly affordable, I guess, right? Because they don't have to pay for it.
Correct.
If they decline it for some reason, like a spouse has their coverage or something. But I'm just thinking, wow, even if they do that, they're still probably at risk for
You
something.
still have to do the paperwork and all that. Yeah.
Yeah.
You
Oh my
still need
goodness.
to send it to the IRS.
And nobody does that hardly, right? At all. Well, not 100%. They might do 50% or whatever.
But if you think about it, what it did for us as employees, it made the insurance companies offer this coverage for pre-existing condition. So it did help us as individuals because now it's holding those insurance companies' feet to the fire for everything. So, that end, it's great. To the other end, the employer has to offer, insurance that's affordable and that has good stuff in it, not just, here's a little crappy plan.
$2,000 copay is no problem.
And more things. If you're filing late, there's late fees now. We used to have a good faith, when we were first starting out, that, hey, you could be late. Hey, you got the calculations wrong. That's all gone now. Over 10 years that it's been in effect.
Fascinating.
So that's new in 2024. 2025, you'll see these go up, not a lot. I mean, they didn't go up a huge amount, but they're going to go up. So that's
So
whole.
the press release talked about leveraging Trusaic, with all the new things that are coming out and whatnot. Is there a way they could like test themselves without like signing up right away with Trusaic, or I don't know how you?
So we get leads from, partners. I'm a partner person. We get a lot of leads from ADP, UKG, and Workday on this. And what we do is so ADP has a lot of smaller organizations and a lot of, Bill used to work at ADP.
Right.
I remember him coming to, yeah. Anyway, so we do a calculation to see if will they sign up, see if they are an ALE, applicable large employee. So we look at their part-time, we pull that all in and look to see if they have, they might have 40 employees and 20 part-time. We do the calculation. That's part of it. So this year, and that was that press release too, is the IRS is really cracking down on that. If one of your clients gets a 226J letter, they should definitely call us. Because we can go back, we can look, even if like in 2016, we'll go back and look at past, if they were an ALE back and they didn't know it in 2016, 17, we find that a lot too, and help them with their penalty. And then usually we can get it reduced because we're lawyers. We talk to the IRS all the time.
Would you say an ALE?
Yeah, it's an applicable large employee, 50 or more employees.
Oh, large employer. Okay.
Oh, there's so many little acronyms for it. There's MV, minimal value. There's MEC, minimal essential coverage. ALE, ACA. It's the bottom line. It's very complicated, and HR payroll people pull their hair out doing this. So the IRS is cracking down. You get a 226J letter. It's kind of scary. You could call us or another ACA vendor, and hopefully they can help you. So we do all the calculations. We talk with the IRS. We have letters that are already, kind of like standard letters that we send them, and we usually reduce their penalty. But now what's new is they're cross-referencing employers' previous year's ACA findings, validate their claims. So let's say in 20, you had C employees, then you didn't put anything in for 2023. They have, it's AI and all that. I mean, they're keeping up with stuff. They will go back to you and say, how come, you don't have as many employees, or how come, they will actually come back to you.
It's like a gap in a resume. It's like, oh,
Yeah.
that year.
That's a good.
And we didn't have employees, honest.
Oh, we had to let them go or whatever, so.
That happens too, yeah.
Yeah. So that's what's happening with, the IRS. That's what's fairly new, that they're going to see, they may see more 226J letters, and there's other letters they send out. So that's what's happening. And there's a link here that you can kind of look at more information on that.
So how far can they go back? I mean, like I think the normal IRS.
2015.
20, so 8 years, pretty much.
Yeah.
Go back 8 years at a time, or just
Yep. They can go back and say think of like the IRS personally. They can go back.
Like, yeah, I thought it was like 3 years or something in terms of like
No, not
certain
that.
things, but that's at the individual level, but company level, I guess, yeah, they're a lot more. So they have to keep track of all this and store it and keep it safe. And wow, that is a lot.
This is what we call our stair saw.
Oh, I'm already frightened. I'm shaking in my boots, and I don't have any employees.
Well, there you go. There's like crazy amount. And then, these are just some of our, people who had us. And this is funny. ACA compliance used to be the worst thing. So you could see that was horrible. How we reduced the workload and all that. So, and then with our software, what it would look like. It's ACA, you can see down here, here's an overview. You can look at KPIs. You can look at any pending offers that you have out there. What are the missing offers? Reports, and then the codes, and then sending it in. You got to do the 1095 and 1094Cs. But they could click on this. They can look at year-to-date active employee count, their full-time count, requiring reporting, their penalty risk.
Does that mean they actually owe that amount? Or
We could. So they can look at that and click on it and see for each month, where they were. Remember, they have to be 95%. Oh, you're 94 compliant. What's happening there? So they can click on it to see, hey, the threshold wasn't met. You've got someone that very low, maybe minimum wage, and your insurance doesn't hit the minimum value. So this keeps track of it.
So what if they don't know what to do now? I mean, do they just
They can go in? Yeah, so that's up to them, but they can go in and look at, why is my coverage, and go back to, let's say they have Cigna, or they have, Blue Cross Blue Shield, and figure out, what's going on. A lot of their insurance brokers, like we work with Gallagher. So we'll, if they ask us, it looks like there's a problem, you have to go back to your insurance.
So you mentioned Gallagher. I mentioned they're kind of a partner of sorts, right? And you mentioned like Workday, UKG, and so forth. So if a customer is like on UKG and they have your software as well, do they have to like data entry all the data, or do they have to import it? What do they do to update and maintain this, and how often do they have to do that?
Oh, great question. Yep. So we already have interfaces, or integrations, I should say, not interfaces, with UKG, Workday, SAP. Leave anybody out? We already have in there, but otherwise you would just download, if you have something else, like, I don't know, whatever payroll system, you download the information CSV and we pull it. But we walk you through the whole thing, because it has to be, you have to make sure that you have the information in on time, or you get penalized. So you can see that this is really a big game changer for organizations, having this visibility to it. So this is all like the things that we do and all that, the data accuracy, and you can look at each employee, here's the eligibility. And a big thing is their hire date, and if they're terminated, sometimes you're already counting them as, even though they're terminated, as an employee. So you could save money there. And that's really it about ACA. And I'd love to talk more about partnership. If you have any clients or anybody that needs help with ACA or pay equity.
Special thanks to Jayna Smith, VP of Global Partnerships at Trusaic. See you all next week at the Town Hall.